Morning. My name is Linda Greene-Finestone, and I'm from the Public Health Agency of Canada, and I'm pleased to tell you a little bit about how we use the dietary reference intakes. Next slide, please. So the Health Promotion and Chronic Disease branch is the federal lead on preventing chronic diseases. We collaborate with other organizations in the health portfolio, particularly Health Canada, and of course other organizations, other federal organizations. The chronic disease mandate of the branch is to support chronic disease prevention, conduct activities that address the determinants of health and risk factors, such as nutrition across the life course, and also to build a science foundation to ensure a strong evidence base for the agency's use. FAC, as we call it, has long been supportive of the effort to develop a framework for chronic diseases based on, for DRIs based on chronic disease endpoints. And FAC funded the 2009 planning meeting for chronic disease indicators. Next slide, please. So I'll take you through the next few slides on FAC's approach to nutrition and chronic disease. The first is to understand the issues. So we conduct research to better understand the diet-health relationship, using survey data and available DRI values to help us interpret the nutrient estimates from them. We evaluate dietary status at the population and subgroup levels and conduct surveillance to look at trends in chronic disease and nutritional and other risk-benefit factors. And at the bottom, we have some very good tools to help us do this. Next slide, please. In the next step, so we try to look at possible solutions, explore the literature to address this, and also to estimate the impact of any potential solutions. So one of the ways we can do this is with modeling, and we have a population health model we call it POEM. It has, there are different versions of this model depending on the outcome we're interested in. You know, one is BMI, another is MI, myocardial infarction and stroke. So we apply surveillance information and intervention evidence to the model, and the microsimulation assesses the projected effect of an intervention on the population health outcomes and healthcare costs to estimate the chronic disease burden. So an example of this is we used front-of-pack labeling scenarios based on an article from based on an article in the literature using UK standards. And so these scenarios were promoting healthier consumption of calories and sodium, and we did this for Health Canada to help inform policy development. Next slide, please. And so this was just an example of the kind of thing that we did, and we could see that with this front-of-pack labeling, it was eliminating 117 calories and 181 milligrams of sodium on average, and we could see the effect on in terms of the years free of the 5 sources of morbidity, and also this was the sum of the 5 sources of morbidity, but pulling out hypertension, there was a decline in hypertension as well. Next slide, please. And the last part is putting evidence into action. So FAC is able to do this through our programs, and some have nutrition components. And just stepping back a bit, so the DRIs are established by groups such as this, and then they're incorporated into guidance through Health Canada. And as Hassan Hutchison said, they underpin and contribute to the guidance. So the programs that have nutrition components address nutrition education and healthy eating, food literacy and skills interventions, and we do this through grants and contribution programs. We work with non-governmental organizations or corporations one-on-one with funding. And so here are some examples: Farm to School, Kid Food Nation. Those are for children. Kid Food Nation curriculum was developed by Dietitians of Canada. Food Fit is for people with income issues, and it's a food and fitness program for adults and youth. Next slide, please. So moving forward, we look forward to your deliberations and your reference values and your advice addressing Canadian population characteristics where relevant. Chronic diseases are our most prevalent health problem and often are preventable. So chronic disease-based DRIs have the potential to make an important public health impact. Thank you.